Welcome to Ask Melissa Almost Anything, where we talk about your life and your body, where we believe your health is your responsibility, that you have a choice in your health care, and where pain is not normal. I'm your host, Melissa Meiste with Nephew Physical Therapy. Today, we'll be talking about your kids' pains and strains. While pain is not normal, which we talk about regularly, regular complaints of aches and pains from our kiddos is very normal. I have two adolescent boys, and there's not a day that doesn't seem to go by where they're out playing, riding their bikes, climbing trees, where something hurts. Now, growing pains is obviously a common thing at this stage, and trying to be able to figure out the difference between a growing pain and maybe a strained muscle or a achy joint is something that I find seems to be a regular occurrence in our home. And as a physical therapist, I usually know what to look for in regards to loss of motion, loss of strength, or loss of flexibility. But for most parents, when our kids come to us and complain about something hurting, we're kind of put on the spot. What do I do? Do I take them to the emergency room? Do I take them to urgent care? Do they need to see a specialist? Will a Band-Aid do? And so today we want to talk about those things, give you some tips and tricks on actually where to go and who to call, and answer your questions today that you might have specifically about your kids. As we know, 2020 has been a very strange and unique year. And while many of our kids have been 3-4 weeks, months into maybe a sports or traveling season, while they may have been doing more extracurricular activities, a lot of those activities have been delayed or put off. And while our kids may have not been as active in those last few months of school, they may be struggling with some things that you wouldn't normally see because, again, their life has changed just as much as ours. So what we want to talk about today is what's going on with your kids. How are you trying to manage that as a parent? Just a couple weeks ago, was on date night with my husband. And date night usually includes going out to dinner in Lowe's or Menards or Meijer. And so we were wandering through Lowe's looking for things for our home improvement project. My phone rang, and a friend of mine had called in regards to the fact that her daughter, who just started soccer, couldn't walk off the field. So, of course, not the easiest way to diagnose somebody over the phone, but I asked some questions. So apparently she had heard a pop in her hip by doing a swiping kick at the ball, a sideways outward motion. So figure that out with my friend. She couldn't put weight on it. Hip was hurting. What stretches do I do? That was the question. Well, with an initial injury, my first piece of advice is it's usually not something we're going to stretch. But I wanted to know just how bad it was. Where was that pain? Because when we talk about the hip, that's kind of all around the side, which we often think is the hip at the top, near the waist. It actually can mean up into the inner groin. The hip also creates part of the glutes. It's where all the muscles attach. And then you even have the front of the hip, which is the hip flexor, that part right at the crease when we sit down. So we're figuring that out. And I asked her to kind of poke and prod. So when your kids are hurting, one of the things we got to figure out is where that's at. Well, they may not want us to poke and prod. I wanted to know, was it more joint? Was it more muscle? Well, it was actually more the inner thigh up into that groin region. And mom could definitely tell it was a problem because once she got to about mid-thigh, daughter was not having it, right? We know that with our kids. If we start putting them in pain, they're going to stop us right there. So we figured out it was probably that inner thigh. When I was thinking about the mechanism, the activity that she was doing when playing soccer, very possible that she had strained that muscle. But as a friend, right, with a physical therapy hat on, trying to advise her over the phone, we're looking for options. And as a parent, the question is, are you looking to go to the emergency room or urgent care? Now, I am not a medical practitioner in regards to, medical doctor, a nurse practitioner, or a physician's assistant. And so my advice does not supersede the importance of seeing your doctor. Always the disclaimer. But the question I always ask myself as a parent is, if I take them in, what am I looking to accomplish? All right. Now, if it's pain management, that's one thing, right? We can be in so much pain that we do need additional help from somebody who can prescribe those meds, whatever that may be. Sometimes we're looking for confirmation. And that's where an x-ray is really important. If in fact we think something's broken, because an x-ray is the best tool to determine something broken. In regards to strains or muscle issues, an x-ray isn't going to show up a lot of soft tissue damage. You're going to need something more extensive. And based on my experience and all the other things that we're seeing, very few MRIs are being done in the emergency room these days, as we are relying then on the orthopedic specialists to do that follow-up testing and examination. So what we're seeing then in that situation is, as a parent, is it worth the ER visit? Is it worth urgent care visit? Because of course that depends on the time of the day, because of course our kids are never sick when the doctor's office is open and we can get it. But as we talked through it, my basic piece of advice is this. If you think your kid has sprained or strained something, one, they're going to need to rest. Get off of it. And so because it was the hip, I didn't know if she would be comfortable laying on her back. So a recliner sometimes is a good relaxed position. Sometimes we want the knees bent. All right. So figuring out where she can get comfortable. Then we're talking icing, friends. And icing can be overutilized. I have seen it where people just throw it on and leave it for hours. My recommendation on icing is usually 15 to 20 minutes at a time, where you're putting it on the area that is sore, okay, or the source of the symptoms. And so sometimes it's a little bit more difficult to identify because symptoms from the neck or the back may show up down the arm or down the leg. And really what we need in those situations is icing on the spine, okay? But again, if you're not a physical therapist or a nurse or a doctor, we understand that you're going to put that ice where that pain is, because we need to calm down the inflammation. Usually in an acute or sudden injury, we're going to have inflammation come to that area. That's how the body's way is about attacking it and healing it. And that inflammation puts pressure on muscles and nerves, and we want to calm down that inflammation. So ice is your friend. So 15 to 20 minutes, take a break for an hour or so, do it again, okay? So we're just calming down that pain. Rest, ice, elevation, depending on where it's at. Now this is where, when we're talking about maybe the foot or the ankle, a common ankle sprain, we're elevating that foot above the heart. This is the step that's often mixed. This is where if we truly need elevation to decrease swelling, it is where you are laying on the floor and maybe your foot is propped up on 2 or 3 pillows on the couch. The recliner doesn't count. The area that is sprained, again, this is traditionally when we're talking about ankles, foot issues, maybe the knee, we want to elevate it if it's really, really swollen so that fluid can go back to the heart and get processed and move out of the system. The last one is compression. So in acute injury, which is a little bit harder to do in a hip, which is the situation we're talking about right now, compressing a muscle or a joint prevents swelling from accumulating. So that's why if you think you sprained your ankle or your foot, unless you have an ACE bandage to wrap it up when you take that shoe off, it's often best to leave the shoe on because it doesn't allow the space for the swelling to go. Okay, so hopefully that makes sense. Compression is one of the most important things when we're talking about a sprained joint, specifically the ankle here, because if there's no room for the swelling to go, we don't lose range of motion. Okay, and so that's where when we're talking about a muscle or a joint, that maintenance of range of motion is what prevents all the other things from happening, limping, pain, all of that stuff. So it's that initial thing is all about keeping that swelling, which causes inflammation, which causes pain, under control. So back to my friend's daughter who was playing soccer. So we decided she needed to rest. Okay, she needed to ice, but she did not need to stretch. And here's why. She needed that muscle to take a break, and we needed to see where it showed up. Did we need to do hip flexor stretching or hip adductor stretching, inner thigh or the front of the hip? We're not sure at that point, and that muscle is protecting and guarding at that point because that muscle kicked in to prevent further damage in some other part of the body, like a broken bone or something else, because that sudden force and velocity of that swiping kick, meeting force and resistance, caused that muscle to protect the body, but therefore was irritated, and the daughter couldn't put weight on it. The good news is, after a few days, right, taking some weight off of that, maybe going to crutches, but we don't want to stick with that for a long time. Moving off of crutches, you want to make sure that your walking is happening without a limp. Otherwise, we start to create all other issues. But to the original question, which my friend asked was, my daughter hurt herself, so what should she stretch? The answer is nothing, okay? But in this conversation, as we're talking through whether or not urgent care was an option or the emergency room was an option, one of the challenges is, do we in fact think our kids broke something? Now, I have been lucky to only break my pinky toe, which is a silly story that involves being in the house on the phone with the IRS, tripping over a tricycle, and kicking a heavy piece of furniture. Like, imagine that, right, with little kids in your house. But because I've now had a child who broke their arm, one of the most common things our kids could do. He was out playing in the monkey bars, fell, landed on that arm, came home because he was out with dad and brother, checked it out. Yeah, it was sore, but it moved. He could move all his joints, went to bed that night. I knew something wasn't right because he was crying and woke up multiple times. And as a parent, the next morning, like, what do? I took him to the emergency room because I didn't know there was a better option, friends. And that's what I want you to know today. So this is specifically for those of us in the greater Holland area, greater Grand Rapids area. If this is true in your neighborhood or village, you need to find this out. We happen to have Helen DeVos's Children's Hospital about 30 minutes away. And what I found out, which I wish we had done the first day, but we did go the second day, is they have a walk-in clinic, fracture clinic, in the orthopedic wing of the clinic. They are across the street from the hospital. Now, we go to the orthopedic floor because my other son has had some scoliosis, so we get regular checkups and x-rays and all those kind of things there. So we take Cooper, but Grady had fallen and broken his arm. And talked with one of my friends who works in another department there and said, they have this fracture clinic. You can walk in Monday through Friday, 7 to 8. If you think your kid broke something, you can just show up. And it's a first come, first serve basis. Now, you can make an appointment. And certainly they said, don't go if it's been months, right, since your kid injured themselves. But if you think, right, they sprained something really bad, next morning, we went to the emergency room. They took an x-ray, wrapped it up, okay, and said, go see an orthopedic specialist. We could have skipped that step. Oh, it saved the money and time because the next morning we went to Helen DeVos's urgent fracture clinic. Saw one of their skilled professionals, didn't have to redo the x-ray, so at least that saved us. And they were able to determine, because they deal with kids all the time, and you're worried about growth plates, parents, just remember this. Their fractures have an extra element of importance versus when we break a bone because they're still growing. And if that fracture shows up near their growth plate, it can affect limb length, okay, right? Because it can affect the ability of that bone to grow equal to the opposite side. So took them in. Because they're the experts, they can determine cast, splint. Thankfully, we were able to do a splint. It's a real blessing when you've got, a 7-year-old running all over the place and gets dirty and filthy, and you want to make sure that they can shower well. Did that option, was able to do the follow-up. Super easy, super fast. And again, they deal with kids all the time. So my advice is find out, if you're not local, what options you have as to whether or not there is an urgent clinic for your kids if you suspect fracture or if you suspect maybe a ligament strain or sprain, right? You think that they tore their ACL, those kind of things. They manage that stuff. Oh, what a blessing. And so I tell parents all the time, if your kid is having this, go to them. Do not pass go. Now, of course, if it's over the weekend, obviously there's different factors to take into place. And obviously, if it's a compound fracture, let me clarify here as well, right? If that bone is sticking to the skin, again, very different scenario, but this is a great option that a lot of parents don't know. So keep that in mind. It is something that now I keep in my back pocket as an option as a parent who never knows what's going to happen. Gave that advice to another parent recently who, again, got referred to an adult orthopedic clinic, which, again, is a very good option. But depending on how urgently you can get in next day in regards to business hours. So totally a very, very, very good option for parents. Okay. And I wanted to make sure you guys knew that today. So again, if you're joining us, if you have any questions in regards to pains or strains of your children, here to answer them today. As a mom of boys, we got things that are getting bumped and bruised all the time, which brings up another point. Have you ever individually had a bone bruise? I think it's in a pain category all of its own. So now, yes, you're going to get that bruising, you're going to get the swelling, all of those things. But that bone bruise might stick around way longer than any other bruise. I can think of a friend whose poor child, right, got a black eye, and that has hit the bone. It is a living tissue, right? Swelling, bruising. I have dents in my shins from floor hockey, right? Getting whacked in the shin. Think about, right, hockey players, soccer players, all of that kind of stuff. And so that is even something different, right, than a muscular injury, and it will last longer. Okay, parents? So keep that in mind. That's one of those things. Another thing that I get asked a lot, okay, in regards to adult and in children is, do I use ice or heat? So as I already talked about, in an acute injury, ice is usually where you want to go to. Now, kids don't always tolerate it well. Let's be honest, us adults don't tolerate ice as well either. However, when we're talking about lowering the pain threshold, right, decreasing pain, inflammation, all of that stuff, icing is probably your best approach into slowing that down. Now, there are these rough scenarios where we talk about, okay, you should use ice for the first 48 to 72 hours, and then you're doing contrast baths, and then you're moving to heat. The challenge with that perfect scenario is what happens when we either sprain something, strain something, pull a muscle, sprain our ankle joint, any of those kind of things. We often re-injure ourselves. Makes me think of somebody else that I know, injured their knee, started rehab, tweaked it, kind of went backwards. It's almost like the injury starts over again with new inflammation and new swelling and new pain because that ligament, joint, muscle, whatever was tweaked and strained again. So it's almost like it resets. Okay? So if you feel like you have to go back with your children and re-ice, that's not abnormal. Okay? Because of re-injury happens regularly. We try to go back out and test, right? Test our arm, test our leg, throwing, kicking, running, and maybe that body part's not quite ready, and so we can take it off again, right? We re-injure it, retweak it. So that's where the icing comes back in. So again, ice, always good at the beginning. Heat always feels better, not always the best option. Let's talk about long-term limitations of our kids, all right? Now, one of the most common things we seem to be seeing, and maybe this will, relate to some parents more than others, but we see a lot of young athletes, okay, active kiddos, right, that are doing a wide range of sports or outdoor activities, right? They may not even be in a team sport, but they're playing around the yard, they ride dirt bikes, they climb trees, they run, they do all of these things. And what we see is while they're very active, a lot of them are very weak. Now we see this in adults for sure, but the question, as I go back to the beginning of our conversation today, is what muscle, what do I need to stretch? Now let's be honest, right? Most of our kids' posture is not doing so well these days with modern technology. And that we can have a different discussion for a different day. We've talked about that in the past on tummy time and opening things up. But when it comes to the strength of our kiddos, they can push through a lot of those things. But when they start to develop knee pain or back pain or shoulder pain, and they actually end up in our clinic, they haven't damaged anything yet being the operative word. They haven't sprained their ACL. They haven't torn a muscle, they haven't, done any of these things, but they continue to have this lingering joint pain. What we find is they're weak. I'm going to pick on those teenage girls right now. If you can see them walking down the sidewalk, those legs are long and thin, and they're kind of wobbly, and they kind of swipe inwards. I'm always thinking of those kids. They swipe, and knee pain is often a result of not getting enough muscular support from those hips, from those glutes. And most activities drive our kids forward. We're going forward. We're not doing enough sideways and rotational motion. So with those kiddos that come in with that joint pain, we're looking to see what do they need to get stronger, because our kids maybe don't get as tender or sore as us old people do, right? Where you push around, oh, that muscle hurts in my back, or oh, that hurts in my leg. They may not develop that long-term kind of painful muscular issues that we as adults may have, but they'll often complain of joint pain, hip pain, knee pain. And so how do we get to that? Well, that's where seeing a physical therapist for a great evaluation, which is, of course, why I highly recommend the team here at Nephew Physical Therapy, we're looking for what's causing it. And so when we look at your kiddos, we're looking for that connection, okay? I'm going to look at your body type. How do our kiddos walk? That gives us a lot of information in regards to what is strong and what isn't. Whether we walk bow-legged, whether we walk with our duck walk, whether we walk toes in, how's our posture, right? How far is that head hanging forward? That kind of quick overview of our kiddos gives us a lot of information on where we need to go hunting. That, of course, makes me think of a story I want to tell here real quick, and then I'm going to get to Heather's question here in the chat in just a minute. But I wanted to tell you a quick story about a young girl, preteen, who had come to the clinic to be evaluated for shoulder pain. Had been treated elsewhere, was seeing a personal trainer, active in swimming, doing some other sports, very, very active. And when I talk about that overall inspection, when she walked in, there was just something about her gait pattern that just didn't seem right to me. She looked crooked, she looked off, not balanced, all of those things. And so I go back to my early training in physical therapy, which encourages just us to get people as naked as possible in American culture while being appropriate. And while I evaluated the shoulder and looked at range of motion, looked at the relationship between the neck and the shoulder and the strength and all those things, the way that she was standing there just wanted me to take one step further out. So we put her in a gown. I'm standing behind her. I'm looking at those shoulders. I'm looking at that neck. I'm carrying that down her spine. And she's crooked. She is rotated. Her hips are off. She's got those knees that are turning in. Nothing is looking level and symmetrical. And because, as a parent, like I mentioned earlier, with a kid who has scoliosis and being a part of that process of identifying it, I started to think, why is she overusing this shoulder? She's young, she's healthy, she's a great swimmer, she does all this stuff. Well, the rest of her body was not giving it the support she needed. And so, yes, did she need strengthening for that shoulder? Did she need other things? But the curve was significant enough that she needed to see a specialist. And so that's why it's really important for us as physical therapists and as parents to sometimes take a step or two back from the situation. What do we see is going on with our kids? Right? As I look at Heather's question here in the chat that says, my 12-year-old has flat feet that causes her pain. We've gone to a podiatrist and gotten better shoes as well as over-the-counter shoe inserts, but she still complains after long periods of time on her feet. Do you recommend, do I have recommendations for this? And stretch recommendations, right? Again, there's a theme as parents. We often think we need to be stretching out our kids. So there's a couple, the feet are kind of an interesting thing. And like I was just mentioning in regards to taking a step back, right, with this preteen girl with a shoulder issue, when we look at foot issues, we do need to take a step back. So from a family genetically that has one branch has excellent feet and another branch that has horrible feet, I'm thankful I got my mom's feet, not my dad's family's feet. If you know the Nephew family, you would know what I'm talking about. So some of that, when it comes to foot development, does seem to be genetic. Okay, so some families definitely have a higher arch, some seem to have a flatter arch. So this may be something that you see, right, in your lineage or your husband's lineage. So sometimes that is just what it is in regards to our development. But when we see flat feet, okay, that means we're not distributing the weight evenly through the foot as it was designed to. Okay, same is true actually if that arch is too high. So we're not distributing weight evenly, and so therefore you're not getting the support that you need. So by getting better shoes and getting the inserts, we're trying to artificially create an insert, or I'm sorry, to create an arch, right? To improve the mechanics of the foot. Now, in regards to recommendations, so as I always say, when we're making these recommendations, I often have more questions than I have answers, and it's given on the fact that I don't have this child right in front of me, right? But these are the things we look for. Okay, so when we have flat feet and we have a foot issue of any kind, when we're standing there, right? So this is my suggestion to Heather and anybody else who's listening. If you've got a child with foot issues, when they're standing, right, no shoes on, flat on the floor, what we're looking for is the foot position equal? Meaning, do both toes face forward? Do they turn out? Does one go forward and one turn out? So I'm looking, when I have a kid in front of me or an adult, I'm looking for their natural stance. I'm not correcting them. Where do they naturally fall? So sometimes what we'll see then when we have a foot issue, and I would ask Heather, is one foot worse than the other? Okay, because a lot of times we don't see equal distribution of symptoms from right knee to left knee, from right foot to left foot. Okay, so those are those things. So what we're looking for is, what is that similarity, okay, in that resting foot position? Then I'm going to look up the chain, okay? I'm going to look at the calf size. I'm going to look at the hamstrings and the quads. I'm going to go all the way up to those glutes, friends, because you know that I love them. What do they look like? Then we start looking at symmetry of range of motion, okay? Does the foot and the ankle move equally? That's how we start to determine if something needs to be stretched. In general, and this is a very general statement, we start to say stretching in regards to the foot. We often find most people are very tight in their calves, okay? So that is a simple calf stretch, is where we maybe stand on the edge of a step and we've got the ball of the foot on the step and we lower the heel down towards the lower step to stretch the back of the calf. That same position can also be reproduced. We put the ball of the foot up on the wall with the heel on the floor, and we take our whole hips and we move forward again to stretch the calf. Okay, so if we see a loss of motion in that foot where we can't pull the toes up towards the knee, there may be calf tension. And that calf attaches all the way right down to the heel, and then a lot of the small muscles of the foot attach from the bottom to the heel. So we want to make sure that there's movement and flexibility through that calf. That's a general thing. Another general stretch is where you take a tennis ball or a golf ball, and I highly recommend the tennis ball, and you roll the foot around on top of it. That is a way to stretch or do a little bit of massage on the small muscles on the bottom of the foot. So that's how you can start to create more mobility. All right, so stretching is something where we see a loss in motion of a muscle. Okay, that's what stretching is. Stretching is to lengthen a muscle, and we do that because the joint is not moving fully, and that muscle is stopping it. The other thing, though, when we talk about flat feet and pain, is the foot getting enough support from the muscles further up the chain. Okay, so one of the examples I like to give is we really should see our muscles go from large in our buttocks glute region to medium in our hip and in our hamstrings and thigh, in our quads, to small in our calf, to extra small in our feet. Okay, it should taper down. That is a normal, healthy muscle pattern. When we see no butt and big calves, that relationship or that ratio has been thrown off, right? Because if the muscles and the glutes go away, somebody is making up for it. And if somebody is making up for the loss of a muscle somewhere along the chain, it's probably going to fatigue faster. Because if you want to think about a 6'5", 300 and some pound linebacker in football, right? Huge. Or a power forward in basketball. I mean, these guys are huge, big muscles, strong, tall, big. Think of them as your glutes, right? The work they can produce is much greater. Think of the muscles in your feet as small and bendable, still strong. Think about that as your, miniature 5 foot tall, 110-pound gymnast who's bendy and flips and flops and does all those things. Our foot is made for lots of motion. It's still strong, but it's made for mobility, whereas the glutes are made more for power, right? It also creates a significant amount of our motion. But if that relationship, okay, between the glutes and the feet becomes imbalanced and somebody doesn't do their job the way they're supposed to, okay, so if the foot doesn't have enough motion, okay, the gymnast isn't bending enough, maybe that knee in the middle, I haven't given him a title yet on what his sport of choice is, but he may make up for it. Okay, or vice versa. Okay, and so we need to think about what the job and the role of those things are. So when we see somebody with a flat foot condition, we do need to dive a little bit deeper. Is there enough strength in the hips, in the glutes, in the hamstrings, which is often, again, weak in our preteen, late adolescent kids, because their body is changing sometimes so fast. I think of my 10-year-old who's significantly growing more up than out, which means his muscles are constantly getting stretched. As that bone grows, that muscle has to lengthen with it, and things are hurting, okay? And he can't always keep up with his strengthening as much as his body is growing. So again, back to your question, Heather, my advice, without evaluating your 12-year-old, would be some calf stretching. I would be working on that, make sure there's just enough mobility there and that's not too tight. I would be spending a little bit of time on a tennis ball. But I would be getting back to, and of course it's hard with our kids, right? Having them do exercises of any kind that are not playful is a little bit boring. Heck, it's boring for us adults too. But I would be looking at bridging. I would be looking at hamstring contractions on the edge of the couch. I wouldn't jump to squats or lunges or those kind of activities yet, but I would be doing butt and hip strengthening. I'd be doing clams. I'd be doing those type of exercises to build up those hips to see if that would give that foot more support so it's not doing all the work at this point. So those are the things we would look for, okay? And then, of course, evaluating the gait pattern. How are we walking? How is it all moving together? All of those kind of things. But when you talk about just from a simple recommendation, some simple stretching, but as always, as much as you can, get to the core strengthening, which is butt, gut, and hamstrings. Okay, not just abs, butt, gut, and hamstrings. Get those muscles all working together to build that strength. So that's an excellent question and something that I think a lot of parents are seeing in regards to these everyday pains. She didn't fall off a tree or get hit by a bus, didn't have anything traumatic happen, but this pain has developed over time, which is not so unlike us as adults, but because they have a harder time explaining their symptoms. And that is very much something I've experienced with a child who's, like I said, had some scoliosis, and another child who's broken their arm and some other things. What's difficult for us as parents is getting an accurate description of what that is. I can ask you as an adult, is it stabbing? Is it burning? Is it throbbing? Is it aching? Is it burning? Is it numb? Is it tingling? I can give you all those descriptions, and because you have enough life experience, we know what that feels like, and we can describe those symptoms. But ask a 4-year-old to describe if he has numbness and tingling in his back, it's going to be very, very hard because they don't have the vocabulary to do it. And so think about how do we get them to explain those things, giving them more options in language, trying to reproduce that with our kids. Does it feel like this? Does it feel like when I poke you? Does it feel like when I, rub? I'm not encouraging anybody to hurt their kids, but sometimes we need to help them with the language and determining what it feels like, because the great thing about the body that God designed for us is different descriptions of pain give us an idea of what is injured. Numbness and tingling is traditionally connected with the nerve. A stabbing pain can be something more local. A throbbing pain may be vascular, may just be inflammation. That pattern of the pain, does it just stay in one spot or does it travel? All those questions that we ask adults that sometimes is hard to describe as adults is even harder for our kiddos to try to explain. When I as a therapist ask you as an adult what makes it better and what makes it worse, that's a hard question. When I say, okay, I give you some suggestions, is it better, worse, or same when you stand? Is it better, worse, or same when you lay down on your back, when you lay down on your side, when you lay on your left side, when you lay on your right side? Is it better with a pillow between your knees? Is it better with your head forward? Is it better with your head back? Is it worse in those positions? We have to ask all those questions, and the sooner we get some of those answers, it leads us to the root of the problem. It leads us to what's going on. So as best as we can and as patiently as we can as parents, trying to help our kids figure out what's going on will help you give the medical professionals that you may or may not be interacting with the right kind of information. So excellent question. Excellent thing to kind of think through, Heather, in regards to these kind of ongoing lingering issues that our kids may have that they complain about, and we may just go, oh, are you kidding me? You're complaining again, right? It depends on our relationship with our child. Are they a complainer? Are they not a complainer? Isn't that funny? One kid we take a little bit more seriously than the other, depending on their history and their personality. And as parents, we have to sift through all of that. So definitely something and a challenge that we need to do. I'm going to end on this note, friends. When it comes to our kids in regards to taking care of their aches and pains, and whether or not we go to the emergency room or urgent care or the family doctor, or we go to a children's hospital, all of those kind of things, just like it is with adults, the sooner we get to the root of the issue, okay, is that symptom because it's just genetic, it's just going to be that way? Is it because they actually have scoliosis? Is it, as in my child's situation, they needed an MRI to figure out what was actually going on with their brain and spinal cord, not necessarily with their spine and the orthopedic component? And so getting to those answers, looking for second opinions, this is what we are as parents. We are our children's advocate. And sometimes we make a great choice and we're so happy. Sometimes we have to get two different opinions. Sometimes we go to the emergency room and we could have gone somewhere else and saved some money. And also, by the way, we're usually much faster to pay for things for our kids than we are for ourselves, moms. Like, I get that. I totally get that. So when it comes to your kids, keep in mind, and again, this is the physical therapist talking, if they have these ongoing lingering pains and it's affecting their function, okay, it's affecting their ability to interact in everyday life being their ability to function in the classroom, Lord willing, we're going back, or their ability to sit down and read, their ability to go for a bike ride, climb the stairs, sleep, all the things that are important to us, just as important to them. If that's lingering and lasting and you need some help, we can help with that, because we would do an evaluation. We're going to look to see if there's limitations in those muscles or joints. If we think it's not appropriate for them to do physical therapy, which I've already described, right, in the case of the girl who had scoliosis, we'll help you get to where you need, right? I was like, you need an x-ray, you need to end up, downtown, those kind of things. We can help provide some of those answers. Of course, children, again, a little bit different, a little bit harder to keep on track, but I'm telling you, resolving these issues earlier on, okay, talking to adults and children here, the earlier we address them, the less likely we are to do something further, to do something worse. So that's what we're here for, friends. We've said it once, we'll say it 1,000 times more. Pain is not normal. Pain for our kids is not normal, although it's a little bit more normal with my kids than maybe yours. Just depends on how much, how many Band-Aids they're asking for every day. but it's not normal. And we want our kids to stay active and healthy. We want them to engage in whatever classroom setting they are in these days. Pain detracts from that. We know it's hard for us as adults to function well when we're in pain. So, pain is not normal. Parents, what you going to do about it? And don't forget, we're here to help. Have a good day.